Okay, so here's that upper joint. That's it? Okay. There you go. Ooh, good job. That was awesome. I'm so proud of you. Okay, go and stand. So you said you were just doing yoga?
Yeah.
Nothing crazy?
Nothing.
It was just your, what, pulling the leg towards you?
Yeah.
Okay. So was it when you pulled it like all the way up, like on your, you're laying on your back?
Yeah, I was laying on my back, but the thing is it didn't hurt like while I was doing the stretch. It's just like I felt that it was like deeper than usual. And I was like, oh, that might hurt later.
Okay, and then it did.
And then it did.
And then here we are.
Yeah.
Okay, point to me where you're feeling that pain. Right in there. Okay.
Yeah, right here.
So right onto that hip. Okay. And so being able to look at the x-rays now, I can see how that's kind of shifted. So basically, you have any soreness right in this area? Yeah. So when that happens, so when that joint shifts down, you're going to see some swelling up onto the top here. Yeah, you're feeling that. And so that's where you're going to see some of that stress here. So the interesting thing is, I know you said that in just about a week ago, right? But looking at the x-rays, your spine is compensated, and this is like years of compensation. So it seems to shift away from that side. And then over here, that's where it kind of comes back to the left here. It's so interesting as you look at the x-rays, and now that I can see your back, like it's so much clearer about what's going on. Yeah, because even right here, this is where it kinks to the left, but it's so much more obvious because now, like looking at from the sides here, you'll notice right here, this side's sticking out just a little bit more than this side here. So not only does it shift to the left, it's also rotating. Basically, your shoulders are rotating this way. I don't ever want to guess on your spine, okay? So we're going to make sure we scan your spine each and every single time you come into the office because, oh, right there, just because I want to know what's going on and how things are shifting and moving. So right there, that's where it peaks. And here, a little bit of stress up on top. It's this lower neck right there. That really goes all the way to that side. Yeah, I feel like technology has been able to help a lot with that. So people aren't just kinking on their head over on the phone.
Right.
They got like AirPods stuck on the Bluetooth.
All that good stuff.
Yeah, so technology has definitely helped, but then also has not helped.
Right.
Yeah, right in this area we got some pressure. It's probably around like your T4, T5 area, maybe T6. And then down here. Sore? Okay, not as bad as that left joint though. Okay, so this soreness comes from the spine as it kind of shifts and everything, so that's been there for some time. This is obviously the one that's the most recent, so that's where you're going to feel a lot of that discomfort. Okay, so we're going to start obviously here because I want to get as much relief as possible, but this is where we're going to need to focus is towards the sacrum and that spine here as well. But because of that being so tender and so inflamed, we're going to work on that left side. Yeah, it's definitely C7 right there. So what I'm looking for is when I tilt your head back, it should glide forward. When I do that for you, it's like, it's almost like it's like stuck. It's like, What we're gonna do, the seatbelt, what it does is when I push the spine forward, I don't want the whole body to move. I just want to get that joint in that one only, okay? So let me bring this, perfect. Right there, it's perfect. Relaxing the head back, there you go. Chin over to this side. There you go. That's perfect. I'm just going to a little bit of a push just like that, okay? And then just chin up a little higher. There it is. Ooh, that was a good one. Alright. Alright, you're going to do just fine here. Okay, so scoot on forward just a little bit. Alright, so this one, I can tell it can be a little sore. This is going to be your hip here, okay? So laying on your right side, head here, face, feet on the other side. There you go. Perfect. And there you are. Relaxing that shoulder. There you go. Ooh, good job. That was awesome. I'm so proud of you. Okay, go and stand. Alright, let's walk that out a little bit. So let's go ahead and walk to the corner.
Okay.
Go on over this way. Oh wow, yeah, that's definitely moving better. Okay, so we'll test it out right after we're done with your mid-back, okay? Let it out. Relax the belly for me. Oh, nice and crunchy on that one.
Oh, wow.
Alright. So what are you feeling right now? Any difference or?
No, I just feel like a little like less tense, especially in my chest.
Yeah? Okay, good.
That's good.
A couple more times.
Okay.
Come back to the corner and then let's have a seat. And so I'm looking at also your hips. How's the hips doing? How's the
It feels better, like getting up. Like I couldn't get up that easily.
Really?
Yeah.
Okay, let's have a seat. Okay, so with that, let's go ahead and just take a look. So again, go and stand for me, just from sitting to standing, and then having a seat nice and slow.
Yeah, I couldn't do that before without it hurting.
Okay. All right, good. So let me just go ahead and scan that here. So good stuff. Yeah, we got some good movement on the spine. I'm really happy with that. And so the biggest thing now is when you go home, I want you icing for me, okay? The reason why I want you to ice, so we got movement in the joints. So with that movement, it's going to start to reduce some of that inflammation. That's looking really good, by the way. The other thing is too, so now when you go home with ice, it's going to help to reduce that inflammation because it's a vasoconstrictor, so it squeezes the blood vessels, and it's going to cause those blood vessels to squeeze, and it's looking much better too. Wow, you're doing so good. And so essentially, we're just trying to reduce the inflammation in the spine. And so walking is going to be a big thing. That's why I like to have patients walk after the adjustment. Yeah, okay, that's doing much, much better. Getting some movement, that's going to keep pumping out the inflammation there. The second thing is with the ice, that's going to help to constrict the blood vessels, reducing some of the fluid in there, the swelling. Heat is a vasodilator, so a lot of times people use heat, and then sometimes it either one doesn't help, or two potentially makes it worse.
I've been using heat.
Have you been using heat? Okay.
The whole time.
Welcome to the practice. Yes. Stick around here. I'll help you out. So basically, so the heat is a vasodilator, so it will actually bring in more fluid. So right now we want to reduce the inflammation, especially the more acute it is, the more recent it happened, the more fluid will come into it. Okay. So right now, we move that pelvis. Again, it's shifting down, bringing in. We're pulling that thing back out, so you can feel it move pretty well. Okay. The second thing we did was your neck. So again, you've lost that curve. We're pushing down that C7, pushing it and coming back this way. Now, over time, you know, it's not going to be a miracle, right? It's going to take some time to get those joints to push and move where we want it to be. But the goal is to push it where it needs to be, but then helping it to stabilize. So later on, we'll give you some exercises. We'll also want to do some tractioning for that neck, just because it's really, we got some work to do on there. Okay. So walking, ice, and then how's your water intake?
Good.
You drink plenty of water?
Yeah, I drink
okay, good.
water.
Okay, perfect.
Yeah,
so next time you come in, we'll see how you do. Over the weekend, make sure you're icing, and then when you come back in, we'll see how things are doing.
Okay, sounds good. Thank you.
So proud of you. Yeah, you did so good.